Cundiff. I'm a first semester nursing student. Today is October 17th, around 9:10 a.m. Today I'm going to be pouring an enema for a patient. So before I enter the patient's room, I'm going to gather all my equipment. I have extra chucks, bed bath blanket, perineal care towels to clean them with. I have lubricant for the enema tubing, a bedpan, hand sanitizer to clean or wash my hands, and then paper towels to remove the enema tubing, as well as clean gloves. Also, before I enter the patient's room, I'm going to prep my enema bag with whatever solution the physician has ordered. Today we're using 500 to 1,000 milliliters of warm tap water. I'm also going to prime my enema tubing by removing any air from it into a waste basket or a sink. I'm going to unclamp the tubing, removing all of the air, and making sure the solution is at the tip of the tubing before I enter the patient's room. I'm going to recap and rehang, making sure that the tip of that tube doesn't touch the floor or any unsanitary item. So then I would enter the patient's room, introduce myself. So my name is Tracy. I'll be taking care of you today. And can you tell me your name and date of birth? So check there. Hospital bracelet. So your physician has ordered an enema for you today to help with your constipation. I'm going to try to make it as comfortable as I possibly can and hopefully get you some relief. Can you tell me the last time that you had a bowel movement? So it was 5 days ago. I would also ask them what the bowel movement was like. Was it hard? Was there, the amount of it? Was there a lot or a little? If it had any straining while performing the bowel movement. And then I would provide patient privacy. Wash my hands, and put on a pair of clean gloves. I also have a tech with me today to help with the enema. So first, before I begin, I'm going to assess the patient's abdomen. So I'm just going to take a listen to your abdomen and palpate before we begin, okay? You let me know if you feel any tenderness or pain. I'm going to listen to all 4 quadrants. And the bowel is going to be hypoactive. Really little movement going on. I'm going to palpate the stomach for any tenderness or hard masses. And then I'm going to drape my patient with a bath blanket to, again, provide some privacy for them. But I will remove the bath blanket so that you can see me perform the procedure. So I would drape them with a bath blanket. Alright, Mrs. Smith, so I'm just going to raise your butt up here just a little bit. And I have a tech with me who's going to help me roll the patient onto their left side. I'm ready to pull these blankets all the way off. Alright, so we're going to roll you to your left side on 3. You ready? 1, 2, 3. And I'm going to have the patient scoot back in the bed just a little so that they're more centered. And flex their right knee as far as they can. Forward. So, before I begin, I'm going to place a chuck, an extra chuck. You can place more than one underneath the patient just to try to keep their bed chuck clean and their linens clean. I'm also going to lubricate my enema tubing before we begin to provide comfort. And I'm only going to insert the enema tubing 3 to 4 inches into the rectum. So I'm going to remove the bath blanket so that you can see. Alright, Mrs. Smith, I'm going to lift your right butt cheek, and I need you to take a deep breath in and out for me, okay? And I would place the enema tubing. Good. So I'm going to hand the bag to my tech and unclamp. You're going to feel a little pressure. Unclamp the tubing, and then slowly raise the bag, going no higher than 12 to 18 inches above my hip. Ow, ow. If they're feeling any pain, I'm going to lower the bag slowly. If they're still feeling pain, I'm going to clamp off the tubing, wait about 30 seconds, and then begin again. As soon as the patient tells me that they are full or need to defecate, I will stop the enema, clamp off my tubing. I need you to take it one more deep breath in and out for me. And remove the enema tubing. I'm going to clean off the tip of the tube with some paper towels and throw those away. Recap it. And assist the patient onto a bedpan. Okay, we're going to roll you back. 1, 2, 3. Helping them up onto the bedpan. I'm going to lift her knees just to put her in a more natural position and raise the head of her bed. Alright, so I'm going to come back. I need you to retain that fluid if you can for me for 5 to 15 minutes, and I'll come back and check on you. I'm going to give you your call light. And you can push it if you need anything, okay? So while they are attempting to defecate, I'm going to go into the bathroom and clean this enema bag out and clean the tubing out and record how much of the enema fluid they were able to retain, as well as how well they tolerated the procedure. I want to document that as well. When I come back into the room, I'm going to clean my hands, wash my hands again, or use hand sanitizer and put on a clean pair of gloves. All right, Mrs. Smith, were you able to have any luck? And she was able to pass a stool. So we're going to help lift you off of your bedpan, okay? So I'm going to lower the head of her bed just a little bit. And we're going to roll you back to your left side just a little, okay? 1, 2, 3. I'm going to try to be careful not to spill that bed pan. And wipe the patient clean before layering them back down onto clean linens. I'm going to wipe her clean. I'm going to remove this chuck and all this and put it in a biohazard container. And then we're going to lower you back down, okay? I'm going to remove her bath blanket. Make sure that she's comfortable and has a call light in case she needs me. I'm going to go step into her bathroom and assess the amount, consistency, color of the stool that she passed, and take a sample if I need to for labs. Empty this and clean out the bedpan, and then come back and reassess my patient's abdomen again for any bowel sounds or tenderness with palpitation, or to see if there's any more hard masses. So I would reassess her bowel. So I'm just going to palpitate one time. Alright, Mrs. Smith, so I will be back again to check on you here in just a little bit. I'm going to make sure that she has her call light. And